I guess I'll just start to review what the objectives of this webinar are all about. We're really hoping to offer all participants an understanding of our there we are, yes. We would like participants to understand our Let's Go statewide dissemination model. I think back in 2011, we were starting to grow across our state, but we have since really put some structure around our dissemination model and what we were asked of our dissemination partners. So we're going to talk a little bit about that. I'm going to provide you with an overview of what Let's Go's evolution has looked like over the last 8 years, and how we're still planning to go above, beyond. We're starting our process for our next 5 years of 2017 to 2022. So we're still working at it. As I mentioned before, I'd really like to provide participants with really understanding our Let's Go key learnings and lessons learned over the last several years. And then finally, I will share an overview of our robust evaluation plan. I think this is one piece that we're happy to share with other communities and other states. As we know in our public health work, having strong outcomes and data are really essential to moving forward. I know that we are not able to have a question and answer period at the end of this webinar, which is actually not so bad, because I usually put out a disclaimer that I'm happy to answer any questions that you may have. I may not have all the answers, but I have a great team behind me here in Maine that I can go back to and see if I can get some real clear comments and responses to your questions or comments. So at the end of this presentation, you will see an email address that anyone's welcome to just email any follow-up questions that you may have, or if you're interested in seeing any of our tools or resources or evaluation material that we use, I'd be happy to share it with you. So with that said, I'm just excited to share our Let's Go story and let you know how we're operationalizing this work in the state of Maine. So next slide, please. So now I'm going to spend some time just giving a little bit of groundwork and background on our Let's Go program. Some of you may be familiar with this, so this may just be a refresher for you, but others may be hearing it for the first time. So I wanted to just spend a little bit of time just going over our history to date. So next slide. Great. So I think we're all clear on what our call to action is. The work that we're doing is really focused on the childhood obesity epidemic, and just really thinking about not only the long-term and short-term health consequences associated with childhood overweight and obesity, but also the grand-scale economic challenges that we're faced with. So this was, it's an ongoing challenge. So this is really where we focus what we term our call to action, and all of our work is, of course, leading towards hopefully seeing a decline in childhood obesity rate in the state of Maine. So this is our, just again, grounding us. This is not new information, but this is why we're doing the work that we're doing. So next slide, please. So back in 2006, you'll see on this slide, we have 7 founding partners. These were 7 organizations in the greater Portland area here in Maine who came together. It was really the CEOs who came together to say, there's an obesity epidemic. We really want to do something about it. Like, we really are committed to identifying a solution and working together on a solution in our community. So it was at that point that this unique partnership of all these different funders, they put substantial funds on the table, and they committed to a 5-year demonstration project, which was executed in the 12 communities of Greater Portland. So, again, it originally started in 12 communities. Our Greater Portland area is our most highly populated area in our state. So they had come together, and at the same time, there was some work happening through Maine Medical Center under the direction of Dr. Tori Rogers, who is now the director of Let's Go, around using our 5210 message in healthcare practices and in schools. So this brings us to our next slide. So at this time, when the founding partners came together and they knew that they wanted to do something about the obesity epidemic, this is when they really came together and decided that our program is called Let's Go, and our consistent message, which there is 5210. I'm just going to reiterate that because I think over the years, one of our lessons learned, having that consistent message is so important, but oftentimes our sites on the ground say, oh no, we're not doing Let's Go, we do 5210. So they weren't making the connection between the program and our gateway message. So that's really, so we blended the two together, the Let's Go logo and the 5210 message. So that was really happening from 2006 to 2011. As I mentioned, it first started in the schools and in healthcare practices. And then from there, we grew the program to have a out-of-school focus as well as a early childhood focus. So next slide, please. So as Let's Go was forming, we knew we had our name and we had our consistent message. We started to look at what we knew and what the data told us works, like what are the solutions around obesity prevention and overweight prevention. So obviously, I just said it, one of the solutions that really works is that prevention is much easier than treatment. We know that. So we knew that our focus really needed to be around healthy behaviors and not focused on going straight to treatment. We also know that communities coming together is essential, and that having a consistent message across multiple settings is essential to being successful. We are aware that environmental changes and policy changes are key in making sure that everything that happens is sustainable and that it actually leads to a cultural change, opposed to just a one-time activity that may be great for increasing knowledge, but may not be as sustainable in long-term outcomes. And then we also know that it's going to take very small steps. It's taken 3 decades to get to where we are with the obesity epidemic, and we are aware that it's going to take a while for us to reverse it. But taking small steps and having small successes along the way really helps to keep the momentum going and to get the commitment in the long term. So those are the solutions early on that we looked at that we knew worked. So next slide, please. And again, it's really not about weight, it's about being healthy and feeling good. So this is a message that threads through all of the sectoral work that we do. It's really about taking the weight out of it and focusing on those behaviors, and about trying to be as healthy and feeling as good as you possibly can. So this is a message that we try to ensure that anyone that participates in our program is being delivered that message, and that they know that that's really at the core of the work that we're doing. Next slide. So this here is our multi-setting model. As you can see, we work across the 6 settings that are outlined here with our mascot, Ready. We follow these core principles, which are that healthy places support healthy choices, that consistent messaging across the settings is absolutely essential, and that all of the strategies that we're doing within the settings are recommended by the medical community. So essentially, while we have our gateway message that ties everyone together, the strategies that we're implementing on the ground align with national best practice standards. So we know that we're really following. Sorry, a little bit of feedback. Ooh, I can hear myself. So we know that we're really following best practice strategies across the board. So I do want to just mention, so Let's Go is really based on the premise that if a person or in a family or a child in a family hear and see a consistent message in multiple settings, and if those settings have environments that support those behaviors, they're more likely to implement those behaviors or adopt those behaviors for their own personal lifestyle. And what we're finding is our data is telling us that we are seeing behavior change. And it is that multi-setting approach that continues to be providing us with great feedback and great data that it is in fact working. Next slide, please. So our message. So I think most of you have seen it, but I will just run through each of these numbers. Again, each of these numbers are based in science. So there is a scientific evidence to support our use of each of these numbers. So the 5 is 5 or more fruits and vegetables a day, 2 hours or less of recreational screen time daily, 1 hour or more of physical activity daily, and 0 sugary drinks. And drink more water is really our message that we share. So this is our consistent message that is woven through all the work we do across the settings and across the state. So next slide, please. Okay, so we knew what solutions worked, and so at the end of our 5-year demonstration project, here were some of our key learnings that we identified. One is true that the consistency in the message and the consistency in the approach is absolutely critical. So we definitely, in this learning, we made sure that as we moved forward in the next 5 years, that we were aware of that and realized that we probably need to do a little more tightening up of our approach out to sites and making that a bit more consistent. One of the key learnings is that working across a community wherever kids live, learn, work, or play is essential. So again, gets to the multi-setting model, which is not new to any of you. Another key learning is that the environment, it's the environment, not the activities that matter the most. So it's really about, it's not necessarily about the health fair at the school, while that is great to increase awareness and knowledge even, it's really about ensuring that there are non-food celebrations happening at the school, or that they're not bringing cupcakes in for birthday parties at the childcare site. So it's really about changing the environment, not necessarily about the activities that really matter the most. Next, no-brainer, but absolutely critical to the work we do, is that partnerships and collaboration are absolutely paramount. In addition to partnerships and collaboration, it's the relationships that are just key to our success. Relationships with the sites on the ground, relationships with our senior leadership across the state, relationships with our state programs, relationships with the school boards, and everyone. It's just such a key piece, and really I think a key piece as to why we have seen so much success. It's really about those relationships. And finally, and probably one of the biggest lessons learned that we've experienced, is that innovation and risk-taking have been really key to our success. We often define ourselves out to our partners as a quality improvement program. Over the years, we're always trying to, we reevaluate what we're asking the schools to do or the healthcare practices to do. We're always trying to fill the gap as to where we identify that there are, that we do have gaps, that we need to address certain populations. So we're always trying to improve upon our processes and how we operationalize our work out to the communities. And I think that has really, and we've been very fortunate that we've had the ability to be innovative, because sometimes that's not always the case for some public health initiatives. So we feel very fortunate in that piece. And also, one thing that we really have found a lot of connection to is this whole idea of collective impact. If you're not familiar with collective impact, I encourage you, and I'm probably preaching to the choir, but it's definitely a framework that Let's Go is modeled after. We have shared measurement strategies with our partners across the state. We have a shared agenda, so we know that we're all reaching towards the same end goal. We have our own mutually reinforcing activities, so we know that what everyone's doing and how it feeds up to the greater good. There's constant communication and collaboration happening across all of our different groups, and that we do have strong backbone organization. And in this case, it's really our Let's Go home office serves as that backbone to making sure that all the other components of collective impact are happening across our state with our dissemination partners. If you're interested in learning more about collective impact, I encourage you to visit the website fsg.org, so franksamgeorge.org, because they have a great number of articles and materials just to just see the framework and see if maybe that's a model that really fits the work that you're doing as well. Okay, so that's the background and kind of the historical nature of Let's Go. So now I'm going to transition to our strategic dissemination across the state of Maine. So next slide, please. Oh, he's so cute. And now, next slide. Great. So strategic dissemination. So this right here is what we call our bubble document, because it's a bubble document. Right here, this shows we have 13 dissemination partners across our state. And a dissemination partner is really an organization that's committed to implementing our Let's Go programs in the schools, out of school, childcare, and healthcare settings, and using that 5210 consistent message across their community. So over the last few years, each of our dissemination partners, they all still look very different. And in a couple slides, you're going to see an even crazier view of this model. But one thing that we have identified is that there is a common core that is essential for each of our dissemination partners across our state. So I'm going to, next slide, please. So what we've identified is that there are really three main components that each of our dissemination partners really need to have to be most successful in implementing our tools and resources. That is a Let's Go coordinator, a team, a Let's Go team, and then an entity or a backbone organization. So what I'm going to do is I'm going to just kind of walk through each of those three components and just explain a little bit more is what we find is the key piece to each of those components. So we'll start with the Let's Go coordinator. So that's the next slide. Okay, so a Let's Go coordinator is an individual who really has dedicated time and capacity to meet the needs of their community. What we have found in the state of Maine is that what we envision as the ideal capacity is one full-time coordinator for a community that has 10,000 youth in a service area. We've just found that that seems to be a good matrix to kind of go off of or formula rather to go off of, because it determines really how many schools, how many childcare sites one full-time person can work with. The other piece of the importance of a Let's Go coordinator is that they are really that local face of Let's Go. While we have consistent tools and resources, there are differences in communities, whether it's their socioeconomic status or whatever, whatever it is. There are unique components to every community, and having their own Let's Go coordinator who really understands these differences is critical. So they are that local face. The Let's Go coordinator leads the Let's Go sites through their implementation of our 5-step path, which I'm going to go over next when we talk about our programs and our program implementation. And then they also build and maintain those relationships. Again, that is really the key thing is the relationship piece. The coordinators all go through a training process through our home office here. And there is a clear accountability to both the supporting entity, which I'm going to talk about next, as well as the home office. So there are things at the Let's Go home office that we really expect from the coordinators, as well as they may have other aspects of their job through their supporting entity. So they really need to maintain that strong relationship and accountability between those two different groups. And then finally, the coordinator really needs to have a supervisor who supports the Let's Go mission and has the community connections. So if it's just if the supervisor doesn't really know what's happening with the Let's Go work, that doesn't necessarily work. We really need to make sure that the supervisor is fully committed and understands the goals and the mission of Let's Go, and then also can connect them to their community partners. The next component that's critical is the Let's Go team. So next slide, please. And there's really two levels to the Let's Go team. So first you have your Let's Go, the strategic team members. So that's the coordinator's direct supervisor and the entity leadership. They're the ones that are helping to focus on sustainability, meaning the funding structure of the dissemination partner and the funding of the coordinator position. They're the ones that help to align the Let's Go goals with the maybe overall strategic goals of the organization. So they're really looking at the higher level strategic planning. And then you have your implementing team members. So these are the just a network of local partners who can help to implement Let's Go in the community. So an example would be if there's a Head Start, a group of Head Starts, maybe they have a nutrition coordinator who oversees the work that's happening in multiple Head Start locations. That person could essentially implement the 5210 Goes to Childcare program within all the Head Starts and just report back to the Let's Go coordinator. So just thinking about if there are other people that you can deputize to do the work in the community is part of your Let's Go team. And then the final component for Let's Go dissemination partner is that entity or the backbone organization. So next slide, please. And the important things that we are looking for with this backbone organization is that the mission and the vision of this backbone organization or entity really ties to the mission and vision of Let's Go. Oftentimes we find the best model is through a health system or a hospital. They often have the same or similar vision and mission with the Let's Go vision and mission. So it's a really nice marriage. The backbone organization really needs to be a clear leader in the region and a strong and consistent representative of Let's Go. Again, another great fit for a hospital or health system. The backbone organization really needs to have the ability to coordinate and leverage funding with other local organizations. Again, this is kind of our grant world. All of the work we do is primarily grant funded. However, if you have a backbone organization that can build in some operating funds to support the work, that's ideal because then it again gets to that sustainability. And then finally, that backbone organization really incorporates 5210 and Let's Go messaging into existing communication channels. So whether it's through their internal net news or other local publications that are going out to their community, that they're including the 5210 message in there. So those are really the three main components that we look for in our dissemination partners. So the coordinator, the team, and the entity. And then what we have done is, again, to put a little more structure around what we're asking our dissemination partners to do, is we have 4 strategic goals that our dissemination partners are working towards each year. So next slide. So the first strategic goal is to establish and maintain the Let's Go program. And this is by meaning implementing our school, our early childhood, out of school, and healthcare interventions. So making sure that they're actually implementing the programs. The second goal is to disseminate the 5210 message and promote Let's Go in the service area to create broad community awareness. And support of the Let's Go program. So while we have a statewide marketing campaign, it's also important for our dissemination partners to support that marketing campaign with their local campaign that they have going on, media campaign going on. So again, showing this consistency across the state. And then the third goal is to ensure adequate funding and staff capacity to effectively implement and sustain the Let's Go program within the service area. Which is exactly what the bullet says. So ensuring that there's funds to actually continue the work. And then finally, to inspire collaboration and alignment around community healthy eating and active living initiatives. There's often public health coalitions that are doing this work. So ensuring that it is really coordinated and collaborated with their local Let's Go presence. So these are the 4 goals that we really work with our partners throughout the year. So next slide. So brace yourself. This is the crazy one that I was just going to mention. So this is another view of our Let's Go dissemination model. And this is really just to show you that the infrastructure looks very different for each of the regions. So the size of the bubble is based on the number of youth that are in that community. And then you can see the blue shading tells you how much of that community is reached through a Let's Go coordinator. So you can see that there are some areas where there's no presence, that we're really working to establish dissemination partners. And there are others that have full capacity, that are doing great. Every community, every site is really, there's a huge Let's Go presence. So this just kind of shows you that although the infrastructure and the size of each dissemination partner vary, those 3 components are the consistent piece for each of those bubbles. So I know this is a little scary slide, but it's one that I really love. So next slide, please. Okay, great. So we've talked about the background, we've talked about our strategic dissemination across our state, and now I'm going to talk about program implementation. So this is what we're asking the sites on the ground. So this is what our Let's Go coordinators are trained to be doing on the ground with their sites. So next slide. I'm going to take a sip of my water first. Sorry if I'm going super fast. Okay. So our 5210 goes to school, goes to childcare, and goes out of school programs. They follow the same path and the same strategies, which I'm going to go over. The difference is that each of the strategies looks a little different for the setting. So as you can imagine, you know, the resources and tools to implement a strategy around screen time in childcare, those tools are very different than the tools that we provide for a school or out of school program. So although the message and the strategies are consistent across the board, the tools and resources to get there vary. So the next slide, please. So every site that participates with Let's Go follows this 5-step path to implementation. And you can just click through all the way to 5. That's great. So essentially a site signs up, or either a brand new site and signs up and re-engages, or they re-engage each year. The second is they create an action plan. So they really assess their environments, and they look at our 10 strategies, and they say, okay, this is what I'm really going to focus on for the upcoming program year. The questions on the action plan match up to the questions that they get for their year-end survey, their year-end evaluation. So there is a consistent path, obviously, the path to implementation for these sites to follow. The third step is once they've set their action plan, they implement the strategies that they chose, and they have a coordinator that's working with them. And then there's a variety of technical assistance that we offer, whether it's a school symposium that we offer every year that's focused on the steps, the 5 steps in our strategies, or we do our national healthcare conference, or we do a variety of childcare trainings across the state, and then we offer webinars. So there's a variety of opportunities where they can get overarching technical assistance, or they do have that one-on-one opportunity with their coordinators. The fourth step is we evaluate. So we evaluate every year in the springtime. Our surveys are out in the field right now for the 2015 program year. And then the fifth step is that we celebrate and recognize. It's again getting back to those small steps. Every one of our Let's Go dissemination partners is encouraged to host a multi-setting celebration at the end of the year. We do a recognition program for each of the settings. So again, it's a way to tie in what's happening across the sectors, and it's really to applaud each other for the great work that they're doing. So and then we start over again. So this is the 5 steps that that our schools, out of school, and childcare sites follow throughout the course of the program year. Our program year does run from July 1 to June 30th, and then we just do a restart at the end of the year. So next slide, please. Many of you may be very familiar with, these are our 10 strategies for success. So these are the ones that these are the strategies that our coordinators are working on implementing at the site level with the schools and childcare sites. The ones marked, the first 5 are what we call our most critical strategies. So these are the ones that we feel have the greatest amount, they're actually called priority strategies. They're the ones that we find have the greatest amount of environmental change, and the remaining ones are really more supportive of those first 5. So our recognition program is based on the first 5, but we also measure implementation of the remaining 5. Next slide, please. This is something that we like to encourage all sites to acknowledge, that this is really a trifocal approach. So not only are we looking, while activities are wonderful, they increase knowledge and awareness, to be thinking about the environments and what can actually change to enable a behavior change. And then also the policy is critically important to ensure sustainability. So it's really that trifocal approach that leads to our lasting changes. And so we always ensure that we let all the sites know that, you know, they all go together. If you're going to do one, be thinking about the other 2 components, and how you may be able to take an activity and roll it into a policy of some sort. So next slide. So our healthcare setting is much different than our other settings. The other settings, they really focus on environmental and policy change. The healthcare setting is really where we're able to have that opportunity to start the conversation around weight and health. Healthcare providers are very much looked at as the experts in their community, and they're the ones who, in most cases, families and patients will respond when they're getting a recommendation from their provider. So our ask of healthcare practices is very different than the other settings. So for healthcare practices, we do ask them to do these 3 components that are listed in front of you. The first is we ask that they hang a Let's Go poster in their waiting room and in all exam rooms where pediatric patients are seen. This is a way to connect back to what's happening in the community. So, and we've heard through our year-end surveys that most children or families would say that they saw the 5210 message in their healthcare practice and in their school. So again, it's making that connection. And then the latter 2 components that we ask our healthcare practices to do are they align with national quality measures. So they're oftentimes practices are already doing them. We're just supplying them with tools to implement them more efficiently and more effectively. So we ask that all providers capture BMI and BMI percentile at well-child visits. And we ask that all providers use the Healthy Habits questionnaire to have a respectful conversation around weight and health at well-child visits. And again, it's a wonderful tool because it allows to switch the conversation from weight, which is often a very charged and challenging topic, to health, which is a much more easier discussion to have when you're looking at, wow, you know, you're doing a really great job at eating your fruits and vegetables, but it looks like maybe you could use some help around reducing your screen time. Is this something you may want to work on? So it allows for that nice conversation. So some key messages from the healthcare setting. We have found it's most successful. Healthcare practices are extremely busy. They have a lot on their plate. So trying to ensure that the ask of them is very simple. And it's something that aligns with something that they may already be doing. So again, it's like a simple 3 quick things, and it already aligns with some activities or standards that they're already striving to reach. So that has really been the focus of our healthcare intervention, has been those basic components. Now, what we do know is that there are some providers and some practices that are interested in going above and beyond and moving beyond the basic components and moving into treatment. So next slide, please. So we do have a tool. This is the Next Steps Guide. This tool was developed here in Maine. It's now available for purchase through the National American Academy of Pediatrics. And what it does is it provides providers or a practice or another staff member at a practice with a great flip chart on doing planned follow-up visits. So if you do have a patient who comes in who has an elevated BMI that you're particularly concerned about and you want to bring back for a planned follow-up visit, it provides you with some talking points. The family is allowed to select whichever topic they would like to choose from. And so it allows them to have that opportunity to do these follow-ups before referring out to maybe a multidisciplinary clinic, or if there's, if there isn't a multidisciplinary clinic that's close by, it allows them to at least start to be looking at treatment with this family. Next two slides, actually, because I think I just kind of talked over one of them. So again, that's a picture of the Next Step Guide. This is kind of why it's important. On this slide, I will also mention that motivational interviewing is incredibly successful and critical tool to be successful in having these conversations. We offer our healthcare practices here in the state of Maine opportunities for motivational interviewing training. And not only is this important for a provider, it's really important for anyone who's going to be having critical conversations or not critical conversations. I mean, my husband is so tired of hearing me use MI on him, and he'll call me out on it. But it's a really great opportunity to, it's a great skill to have. So motivational interviewing is definitely an avenue to go if you're looking at training opportunities for whether it's providers or just anyone you're working with. Next slide. We do have an online training on our Let's Go website all around the next step themes. So if there is a provider or even a staff member who's interested, they can go through, there's 22 modules. They can go through each of the themes in depth. And then by completing a post-evaluation, it has been approved for 5 CME hours, so credit hours. So we do have that available. And moving forward, this upcoming program year, we are looking more at developing a management and treatment intervention for our healthcare practices. Because I think the practices here in the state of Maine have really been focused on those basic components. But we are now ready to kind of move into the next phase. So in addition to having the Next Step tool, we are looking to develop an intervention that practices and providers can participate in around their management and treatment efforts. So more to come on that. So that ends my piece around program implementation. So again, to recap, I did the history, I did our strategic dissemination, and now I went over our program implementation, so what the sites are doing. I'd now like to spend the rest of my time, because I'm just keeping track that I have about 15 minutes, talking about our statewide evaluation plan. So next slide, please. So our statewide evaluation plan really looks at 3 different components. And I'm sorry, could you back up one? Sorry. It looks at strategy implementation. So this is what's happening in the sites and on the ground. It looks at parent awareness and parent knowledge around Let's Go and the 5210 message. And then we also look at behavior change and obesity prevalence. So what I'm going to do is just kind of go through each of these 3 components and how we actually capture this level of data and where you can find our data if you're interested in reading our data reports. So the tracking of the strategy implementation. So this has happened, it's an annual survey that goes out to all of our registered sites. We have, and I'll actually get into some of the findings or results in just a moment. So this survey goes out annually for the school, out of school and childcare. It's actually in the field right now. So it's out in the field for 1 month from May till June. And then the healthcare survey goes out following it. So that actually goes in the field from June until July. So we are aware that this is a self-report, and it's what we're looking for is we're looking for sites, and we're looking to determine how they're implementing our Let's Go environmental and policy and clinical strategies for increasing healthy eating and active living. Because we do rely solely on self-report, there is a certain level of measurement error that we both expect and accept. We do know that self-report is proven in the literature to be an acceptable method of data collection. So we're good with that, but we are always aware that there is some level of, someone completes the survey incorrectly, or there's a high turnover in healthcare practices. So sometimes it's a new office manager who's filling it out. So we are aware of that, but we do know that it is a proven acceptable method of data collection. The results of these year-end surveys also help to determine our Let's Go recognition program. So for the schools, out of school, and childcare, if their surveys come back that they're implementing those first 5 priority strategies, and if there is some communication out to families and policy involved, then it helps to determine what tier of our recognition program they're at. And same with healthcare. If they're implementing those 3 components, it determines whether or not the site is recognized as a site of distinction or not. And then, of course, any results that we get are reported back to our local coordinators so that they're able to really think about what their plans are for the upcoming program year, and they use that to really identify what their technical assistance will be to sites for the upcoming program year. And it's really nice for them to have local data, because that's often really challenging for us to get this local data specifically for their region. Next slide. So last year in 2014, we had over 800 sites that were surveyed. So this, again, across the state, we have about 800 sites. There's probably a little over now 200 communities that we're reaching through our interventions. And we had a very high response rate of 86% across all 4 of the settings. And, I think this really tells us that our sites continue to be really engaged. And also it shows the impact of having that Let's Go coordinator who has those relationships, because the sites know how important it is to the coordinator, and they also know how important it is for us as a whole, as a state, to have this data and to be able to report out on the great work that they're doing on the ground. In addition to, so we have this high response rate, not only because of the coordinators, but we also have a pretty strict process of follow-up. So there's, weekly follow-up that goes to the sites, as well as some person-to-person outreach, not only electronic, but we actually call some of the sites to get them to respond. So that's really, so again, we have a great reach for our, which helps to increase our response rate. So what is the data telling us? So I'll, next slide, please. So you'll see here, this is the results from 2014 and 2013 for childcare, school, and out of school, which is, it says after school here, but we now term it out of school, for our 5 priority strategies. I think we're seeing great gains across the board for the implementation of these strategies. For childcare, one of the biggest challenges is around the providing water and low-fat milk and limiting sugary beverages. So that's one area that we're kind of seeing that they're staying steady, but we also now know that it could be an area that we focus our technical assistance moving forward. With that said, we're seeing a great increase around their childcare sites limiting their recreational screen time. So from 2013 to 2014, you can see that nice increase. For schools, there was really not a whole lot of movement from 2013 to 2014 around providing non-food rewards, but we do see that one of the biggest challenges for schools is this strategy number 1, which is the providing healthy choices for snacks and celebrations. And we attribute that mostly to the healthy celebration piece. Because when you pull out snacks and celebrations, we see the snacks are pretty strong. You know, they're doing pretty well. It's mostly around these celebrations. And then finally, for our after-school setting, you know, we're really seeing some pretty significant implementation of the strategies in after-school. And this could also be tied to the fact that a lot of our after-school programs are a part of a national program, so they have pretty high standards around physical activity and healthy eating that they need to meet anyway. So that's, it's just, they're just doing really some fantastic work across the board. And there, you can see here that there's a really strong increase between the 2 program years for providing non-food rewards that went from 80% to 92%. And also as well as for snacks and celebrations. So some great stuff happening around the implementation of our priority strategies. In the interest of time, I'm going to skip over the next slide because this just gives you a look at our supportive strategies, which again, we're seeing some pretty similar or, some great implementation, some areas where they can improve. But you will get these slides after the fact. So, you can certainly, again, email me if you have any questions about what that data tells you. So around what it looks like for our healthcare practices. So you can see here some significant increases in their implementation of the 3 basic components. We're at 99% of those practices reporting that their poster is displayed in the waiting area. Convinced we're going to get 100% this year. And probably the greatest improvement can be seen with that 3rd component around having a respectful conversation. Seeing that increase from 55% in 2012 all the way up to 87% in 2014 is pretty significant. And I think that could be due to the fact that we now have a much stronger technical assistance plan out to our healthcare practices. So in helping them figure out how the Healthy Habits Questionnaire fits into their practice workflow. So I think that could have a significant impact on that piece. And then for the BMI, most practices are now on an electronic medical record, so it's automatically calculated for them. So I think we've been pretty high with that one across the board. But if you're looking at from 2012 to 2014, there's a pretty significant increase. Next slide, please. Okay, oh, sorry, I hid one. Okay, so the second component, the measuring parent awareness. So each fall, Let's Go really monitors parent awareness using a local market research firm's statewide tracking survey. And so this is conducted via the telephone. And the survey is asking about the knowledge of Let's Go and each of the 5210 behaviors, as well as where parents have heard the 5210 in their community. So just here, looking at this slide here, it looks as though about 1/3 of Maine parents surveyed are aware of the Let's Go program. This is great. I mean, so again, we're kind of seeing that this is a consistent increase over time, so that they have seen it and that they are aware of the 5210 or the Let's Go program. Next slide. And this one you can see around parent awareness of the 5210 message. So the previous one was the Let's Go program. This is the 5210 message. And this has really remained relatively consistent between 2013 and 2014. And it is more than twice what it was in 2010. So I think this is definitely attributed to the work that's happening on the ground, as well as our statewide marketing campaign. And also, I've mentioned this before, but for the past 3 years, the respondents of the survey have reported that they've most likely to have received this information about Let's Go or 5210 in their schools or through their doctor's offices. So again, when you think about just the settings that are probably most critical to be working in. So next slide, and the final component of our evaluation plan is around tracking the progress of 5210 behaviors and weight status. We track this data using another statewide survey. It's called the Maine Integrated Youth Health Survey. We use this to really track those elements. But it really is important to acknowledge that in addition to Let's Go, there are many other organizations and initiatives that are doing work around healthy eating and active living. So this data is not just specific to Let's Go, it really helps to reflect the impact of all the combined efforts. And this is really something that, everyone across the board that is doing healthy eating and active living work in the state are using this data source. Another just piece, this survey has been in the field since 2009, and it's in order to get this data, a school needs to opt in. One of the challenges with this is that they do not release the data if the response rate falls below the 50% threshold. So there are spots in the state or communities that don't have data that they can report out on. But we are seeing some significant changes focused on that 5210 behavior. So next slide. We are seeing a significant increase in the percent of students in grades 5 and then in grades 9 through 12 that are consuming 5 or more fruits and vegetables a day. And I will just point out, so our findings are very similar to what the national findings are reported through the CDC around the consumption of fruit and vegetables and their decline in kids from elementary school to high school. So that is pretty consistent, but there is a statistically significant increase in the percentage of students in the grade 5 and 9 through 12 who reported their daily intake of fruits and vegetables. So that's the 5. Next slide. This one around the 2 message. So both the 2 message and the 1 message, there's really no significant change that we're seeing in the reporting of behavior. So that one, and then as well as the 1 message. And you'll see for the 1 message, there's no data available for 2009, which is a little frustrating. But so again, we're not seeing any statistically significant changes, but this also tells us that there needs to be more of an emphasis on the 2 message and the 1 message. So we'll, moving forward, be thinking more about that. And then for the 0 message, so next slide, we are seeing a statistically significant increase from 2009 to 2013, and then again from 2011 to 2013. So both of these, so the 2-year span and the 5-year span, sorry, of students in grades 7 through 12 who are reporting drinking 0 sugary drinks. Which is fantastic. So we are seeing, so for both the 5 message and the 0 message, we are seeing some statistically significant changes in behavior, but we do need to do some more work around the 2 message and the 1 message. And then the final piece is around, next slide, is the prevalence of obesity. So the prevalence of obesity really has remained steady. There's really we're not finding any significant changes, which is actually a very good thing. So what this is telling us is that this is a positive first step. We're not seeing an increase in the obesity rates. So we are just kind of maintaining steady, which is consistent to what we see nationally. And through another obesity prevalence study with a smaller cohort of practices, we do think we've seen some statistically significant decreases in obesity for certain gender and age groups. But for right now, through this data source, seeing it maintaining steady is a very positive step in the right direction. And then next slide, even more so, we are seeing a statistically significant decrease in the percentage of children who are overweight. So again, this is great because, where do you go from overweight? You go to obese. So if we're seeing a significant decrease in the overweight, then we hope in the coming years we'll see a similar decrease in our obesity rates. So I have like 1 minute left. I'll do some quick key takeaways for our evaluation plan. We know the Let's Go multi-setting model is working. the evaluation demonstrates success in changing environments and policies. We're seeing very sustainable behavior changes and a stabilizing of childhood obesity levels. We're engaging dissemination partners at the local level, and that has been a true key to our success. And then that each region is unique, and that the local coordinators can impact the outcomes considerably. So those are my key evaluation takeaways. Sorry that the last of this was a bit rushed. Again, feel free to email me. I think the last slide has my info, and I will turn it back to Tizzy.
Thank you so much. This was a great hour. It was very inspiring. We loved hearing you talk about collective impact, because we've been looking at that same model to help us with 5.210 plus. And I can see wonderful opportunities for us to talk more about, while we have a decentralized model, how we can centralize things like our evaluation functions. We can be looking at healthy youth survey data here in Washington State. We could have a survey of activities that are being done across the state and put those all together, even though we have a decentralized model for rolling out 5.210 plus. So thank you again for such an inspiring talk and for helping to lead this effort around the country. And to everyone with 5.210 plus, thank you so much for joining us today, for spending this time. We will be sending out the slides to everyone so that you'll have those available. Thank you again.